Hey, Dr. Karen Can here, and it is time for another LifeWave micro training. Today's topic is around a protocol for severe exhaustion. This seems to be going around lately, at least as of the timing of this recording and live. So, I wanted to show you one of the options that you can try if you have severe exhaustion. Now, I'm going to give you the complete protocol, but keep in mind that sometimes you don't need all of those different patches. It's just that I've been hearing about some severe symptoms lately, and who knows what's it related to? Is it related to some sort of ascension process, deep healing process, which that is going on, or is it related to 5G, being rolled out? We're not really sure. There could be a lot of different issues with a lot of different people. Could it be related to medication side effects or just stress overall? Possibly, but it just seems to be a lot worse lately. So I wanted to show you some of the acupuncture points that we would use to activate specific intentions to elevate the energy of the body, as well as which patches we'd use on those points. So give me a moment and let me share my screen so you can see. I actually have a few little slides today. Hi, Taylor. You're always on when I'm on. It's kind of funny. Okay. All right. So we have patches on both the front body and the back body in this advanced protocol. Now, it's advanced not because it's hard, it's advanced because there's a lot more patches than normal. Normally, you can use energy enhancer patches, X39, you're good to go. You don't really need anything more for energy. However, because of whatever is going on in the world right now, this protocol may be more helpful. It's also helpful for people that are just recovering from something. So if they've are recovering from an illness that's lasted many weeks, or recovering from surgery, maybe exhausted because they've recovered from a car accident or something like that, this could be really, really helpful. So the first point we're going to talk about is kidney 27, and I actually have it on me to demonstrate where it is. So if you take a look at your collarbones and you feel along your collarbones, right, and you go to the underside of the collarbones, what you're looking for is a little bit of a space just on either side of your breastbone. And if you push in there, it might be sore. It's usually a little wider than you think it is. It's just underneath here. And kidney 27 is almost like an energy rescue point, okay, for emergencies. The nice thing about this point as well, I like, is because it's very close to the lymphatic ports that dump into your thoracic duct. I know that's a lot of medical speak, but what that means is when your lymphatic system takes the toxins from the rest of your body, it'll dump it up here for it to exit out the kidneys. So by patching in this area, you're kind of doing double duty. At least that's my intention. Number one is to activate this point, kidney 27, that really helps, support the kidney energy and is really, really great for exhaustion, as well as support those lymphatic ports staying open, especially if people have that achy, fluey, hit by truck kind of pain or feeling achiness. This may be a great point to help keep those ports open so the lymphatics can flow into this area. I used to have fibromyalgia, and I know what it feels like to feel day after day to be hit by a truck or to have the flu all day long. I didn't realize till many years later that pain or that symptom had to do with lymphatic congestion and backup. So at least having these here might help with keeping those ports open so your lymph can dump out of you. And we do have many people saying, oh, yeah, this did really help that symptom. So that is patching number one, energy enhancer patches, white on right, tan on left. Energy enhancer patches, there are a set of 2 per application. When you get energy enhancer patches in the mail for the first time, there is a divider between the white and tan patches. So please look for both color patches. I can't tell you how many times that a brand new distributor or customer has gotten the patches and say they don't work. And when we get on a call, I realize they've just used just the white or just the tan. So just know they're in separate compartments. The white's on one side, the tan's on the other, and you need both for it to work. Okay, so with this protocol on the front, we're going to put energy enhancer patches on kidney 27. The next patch we're going to use is Aeon. Now, Aeon is really good for stress and inflammation. And what I notice if someone is overly tired, that sometimes their autonomic nervous system, say that 3 times fast, is not regulating properly. So we think of Aeon when people are stressed and they feel like sometimes too much energy. They're kind of tight and they're like, whoa, they can't sleep and they're jittery. Yeah, it works for that as well. But what we've seen in our studies, thanks to Dr. Thomas Budzinski, is that if somebody is too relaxed, i.e., very, very exhausted and tired, maybe they're in a very profound parasympathetic, or instead of fight or flight, the relaxation response, almost too excessive, to an excessive degree. So putting Aeon on conception vessel 8, in addition to behind the right ear on the back of the neck, which I will show you in the next slide, can be really helpful in combination for emergency situations or for situations where it's very, very severe. Last but not least, on the front body, we have an X39, our flagship product, the stem cell enhancing product on conception vessel 6. Where's conception vessel 6? It's about 2 finger widths, 2 to 3 finger widths underneath the belly button. Okay, so use your own fingers to measure. If you get it 3 fingers, 2 fingers, 4 fingers, it's fine, as long as you're in the general area. Why is this acupuncture point important? Well, it actually is a point that accesses the dantian, which in Chinese medicine is kind of like the storage place for energy. It's much more complex than that, but just for simplification purposes, we're calling it kind of like your energy storage point. So CV6 and CV4, which is 2 finger widths, even lower than that, either of those 2 points would work. So now you have 1, 2, 3, 4 patches on the front body. On the back body, we have energy enhancer patches on bladder 23. Now, this might seem tricky to patch yourself, but I got to tell you, I patch this all the time myself. You just get used to it. In the next slide, I'll show you how to measure the landmarks and place the patches on either side of the spine. It's actually at the level of L2, or lumbar spinous process L2 on either side, about an inch and a half on either side. And again, this is an advanced protocol, so we're using lots of patches. We actually have an Aeon patch either on the back of the neck, on that bump, governor vessel 14, or if you have any sort of anxiety symptoms at all, this can be helpful. That nervousness, you can put it behind the right ear. So either of those places is good. This is one of the specialty protocols where you're using 2 Aeon patches at the same time to help to restabilize the autonomic nervous system that has gone into, either too much fight or flight or too much relaxation mode. Normally, you don't have to use 2 Aeons, just 1 is enough. But like I said, in urgent or very severe circumstances, possibly you may need to use 2 to get the effect. So you can try it for yourself and see which one works best for you. Last but not least, we have the X49, which is the newest patch as of 2022. And that is also a stem cell enhancing patch and helps with strength, stamina, endurance. And we're going to put that on governing vessel 4. So governing vessel 4 is a point that connects with kidney yang. So the kidney energy is very important in Chinese medicine, especially for fatigue. Bladder 23 is one of those that we use the energy enhancers for, white on right, tan on left, to access deep kidney energy and support it. It's like charging your battery. And the X49 on the point in the middle is even extra. So we're really pulling out all the stops here for this protocol. We're really connecting to deep kidney energy as well as balancing the autonomic nervous system so that you can feel better. So let's show you how you can find this point on the back. Governor vessel 4, thankfully, is in between bladder 23. And so you just have a line of patches all the way across. So bladder 23, which is also called urinary bladder 23, can be found by taking your hands and poking the sides of you, okay, and poking down until you feel the edge of your rib cage. So kind of like where your floating ribs are. You make an imaginary line that goes all the way to the back, and I am slim enough that I can actually put my hands back here and, feel the ribs on the side, and then put my thumbs and feel the spine, or upside down in my case, like this. And what you want to do is put patches on either side of the spine. Again, it doesn't really matter if you're a little off. You could be, one vertebra up or down. If you have your intention, bladder 23 is what I want to activate. That can be really, really helpful. So you're going to put the energy enhancer patches like an inch and a half on either side, and then the X49 in the middle. So you might need to practice that a little bit, or if you have a friend or a loved one who can help you with that, that can be really helpful. So all they would do is they would touch the sides of you where the end of the rib cage is, and then make a line to the center of your back and put the X49 first on the center. It might be helpful, and then the energy enhancer patches on either side. Now remember, that's a lot of patches, right? So we want to make sure that we're drinking enough water. How much water? Well, for most people, it's going to be at least 2 liters of pure water a day. I like to actually sprinkle a little bit of Himalayan crystal salt for those people that don't have, minerals that they put in their water, or they don't take a mineral supplement. That's a really easy and safe thing to do, is just put a pinch of Himalayan crystal salt, not just any pink salt. Make sure it is Himalayan crystal salt in the water. And there's like 88 different minerals, I think, 82, 88, something like that, frequencies in there. So it can help with the hydration process. 2 liters a day, which is about 64 ounces a day for the average person. So you want to make sure you're hydrating all day long, a little bit here, a little bit there. It's less useful to drink 8 ounces all at once versus an ounce or 2 every hour, for example. That you trickle charge or trickle in your hydration, that can be even more helpful. So that's the advanced protocol for severe exhaustion. Try it out. There are other double energy enhancing patch protocols as well, but I wanted to keep it relatively simple, just with 2 slides to show you where they are. So again, on the front, you have 1, 2, and then belly button. Then underneath the belly button on the back, you have behind the neck here, Aeon, and then you have energies on the back on either side, and the X49 in the center. So you've got 4 in the front, 4 in the back. Normally, I only like to recommend 5 or 6 patches max per person, but if this is a severe situation and you really feel you need the support in this configuration, since I've already done the protocol for you, you're safe to do that. So if you have any questions on the live, you can definitely post that in the comments. Let me know if you're going to try this out, or is there anybody that you have in mind that you'd like to try this for. And if you happen to be on YouTube, you can also, click like and subscribe to my channel. And then make sure you share this video from YouTube, where it's public, to whoever it is that you feel may benefit from this. If you are not currently a LifeWave distributor or customer and you need some help, you would like to join LifeWave, and you don't have anyone who is near you or that you know that is a distributor, you can definitely contact my team at patchtrainingteam.com. Or if you're in the LifeWave support group, Anna Kadena is there as well, that you can contact her. She's the admin, and then she can help you out and maybe do a little interview to see what your needs are. So what I'm going to do now is just check the notes here in the chat to see if anyone has asked any questions, and then I will answer some questions for a few minutes. Okay, so Taylor says, doing brain balancing, I feel like myself and balanced and happy. Something haven't felt in a long time. Doing Eon behind my ear. Yay, Taylor. Good job. Good job. Okay. Oh, great. I'm glad you get the notification when I do lives. I'm also doing the spot on the inner ankle. Does this help? Yes. So that's one of the alternative places. Instead of bladder 23 on the back, you can actually put kidney 3 as an alternative. So if this is the inside of the ankle, right there, there's the ankle bone, and it's just on behind the ankle bone on the inside of your ankles. So kidney 3, bladder 23 do very, very similar things. And that, you know, an acupuncturist or Chinese medicine doctor will probably tell you a little bit, you know, more details of, you know, tweaking what does what. But for most people, use either spot. So I like to say, use what works. So one day try the one in the ankle, kidney 3, and then one day try the one on the back. The one on the back is a little harder to get to, but you know, with a little bit of practice, you'll be actually quite good at it. How much Himalayan salt? So in your water, say you have a water bottle like so. Okay. All right. So you would just put a little pinch. Just a little pinch in your water bottle. You don't really need to have the water taste salty. It's not harmful to do that, but you might not like drinking it if you're not like a salt addict. So just a little pinch is enough, and it tends to activate the frequency of the water as well. Yeah, so Lori says she's definitely going to try this in the morning. Yes, that's good. Yeah, definitely want to do it in the morning, not at night when you're trying to sleep. Okay, guys? Okay, so Flora, I can't answer that question because LifeWave doesn't claim to treat, cure, prevent, or mitigate any illness or medical condition. We're only talking about symptoms here. The symptom here we're talking about is extreme fatigue. So if that is a symptom related to what you're talking about, you definitely could try this particular protocol. I do have in my LifeWave micro training series on YouTube, a series talking about the symptoms related to long haul. So that is something that if someone is, very, very sick still after having an infection, maybe they have breathing problems, maybe fatigue, maybe fevers, things like that. You can find that at patchtrainingteam.com/micro training. So I'll also put that in the chat. So just give me a moment. Let me type that in. And that's a pretty link that goes right to the micro training. And you'll see one for long haul that may be helpful. There's also ones for breathe better. So if the breathing is an issue, you can check out that protocol. And like I said, it's whatever works. Okay, these are very, very safe. Nothing goes through the skin into the body. It's non-transdermal, meaning that if you're on medications or herbal remedies, things like that, it's not going to mix and interact in a negative way. So that's what's really cool about the patches. It is light. So there's no medication interactions. It's very, very safe. I would say if somebody is a little person, so a young child, I probably would not use this protocol specifically because they usually don't need as many patches as adults for the same symptoms. So just using one set of energy enhancers and Eon, may be enough, or maybe X39 energy enhancers and Eon, maybe more than enough. So this is really meant for adults, teens, adults, who are going through something fairly severe. Yes. So Flora says respiratory issues, headaches, right? So look on the micro training. We have one for respiratory things, and we actually have one for head pain as well. But a lot of times, what you really want to do is get that energy up. So even if you use it for the respiratory symptoms, it may actually help with the headache as well. And you certainly could try this protocol one day and just see, whether that makes you feel better. Let's see here. Sil says, are we supposed to leave the area we wore the patch on for 12 hours patch free until the next day? Yeah, so normally, you put both on the first, when you get up, say that's 8 a.m. in the morning, and then you can set your alarm to remove them at 8 p.m. at night. So that's one of the ways that you can do it. Now, do you have to wear all 8 at the same time? Actually not. So that's a really good question. So for example, I would definitely use both sets of energy enhancer patches during the day. And whether you use double Aeon during the day or night kind of depends. You may have to check it out. But if you're going to use 2 Aeons, I would use them at the same time. But you can choose to do it, at night or in the daytime. Energy enhancer patches, if you're doing 2 sets, do them during the daytime. And then as far as X39, X49, honestly, I don't really think it matters as long as you hydrate during the day, whether or not you use either of them morning or night. Maybe you want to use X39 at night and X49 during the day, or you might want to use both during the day, or you might want to use both during the night. So you can play around with that. So the only thing is just to remember the energy enhancer patches are meant to help you with your energy during the day when you really need it, right? Okay, let's see. Any other questions? Let's see. Oh, okay, yes. Is it normal when I put Aeon on top of my head, I get a headache? Oh, okay. Yeah, so I actually have that today. That's one of the other spots you can actually use in this protocol, by the way, for severe fatigue, especially if you're feeling kind of down and you feel like really, really tired and down. The Aeon on top of the head can lift your spirits up and lift your energy up. However, if you have too much energy trapped in the upper part, in acupuncture, Chinese medicine, we call it liver yang rising. So there's too much yang energy coming up here. When you put the patch here, it could increase that energy up to this area, which then might cause it's like feeling too much energy. Oftentimes it kind of rights itself, but if it doesn't, then I would say put it behind your right ear or here on the throat or thorax area, or even on the back of your neck. Those are all really great points for Aeon brain balancing. And if that still gives you a headache, it definitely means that you need to move some of that energy out of the head. So I would use LifeWave, for example, on the bottom of the feet. That's a really good kidney 1, white and right, tan and left, to really kind of ground the energy, to bring it down. Because you have too much up here. And if you cannot tolerate Aeon on the head, then just use it near the belly, or in the lower half of the body. Okay, let's see. Robin says, okay, so what happens if you can't poop? I actually have a micro training on that as well. And that is a symptom of constipation. We're not talking about treating it as a disease, but that symptom of not pooping enough or poops being really hard. One of the things I like doing is just putting an Aeon patch on the ileocecal valve. And let me just grab my little girl here. So I'll show you. So on the right side, so this is my right side. So on the right side, it's halfway between this bone, the ASIS, the anterior superior iliac spine. Say that 3 times fast. And the pubic bone. So it's about here when you're standing. So putting an Aeon over the ileocecal valve sometimes helps to regulate the inflammation and energy of the valve. So it allows the poop through. It's not too tight, not too loose. So another chiropractor had found out many years ago that this was super, super helpful for his patients who were suffering from constipation symptoms, to just put an Aeon patch right here. Now for diarrhea, you can do the same thing. See if that works. And if not, then you can put it on either side of the belly button, and white on right, tan on left for LifeWave, for example, or energy to help to regulate the stool. So those are kind of the easy stuff that you can try for hard stools. Okay, so Taylor says, gotcha. I love behind the ear. Okay, great. I'm glad you found one that you really like. Any good tip for peas? Okay, so again, you're talking about treating or curing an infection or disease. We can't say anything about that. We're not allowed to say anything about that. So think about the symptoms. Think about the symptoms and treat those symptoms with the patches. Okay, guys, I'm going to take off, but thank you so much for joining me. And I look forward to the next time we do a micro training. And I'm trying to decide whether or not I want to do the next training back to back, which is LifeWave mistakes. Should I do that now, or should I wait till next week? We'll see. As I talk, I feel like I gain energy as I interact with you guys. So thank you for that. All right, I will talk to you next time. Again, remember, if you're on my YouTube channel or wherever the platform you're seeing this, go ahead and click like and subscribe and share it with anyone that you think might benefit. All right, good night.